Hi guys, good morning. Can you all see my slides?
Good morning, ma'am. We can see your slide.
Okay, all right. Thanks for the confirmation, Mitni. Okay, so let me go into the presentation mode. Can you guys see the slides in full screen or is it black?
It's black, ma'am. We can't see.
Okay, all right. So then I'll probably have to go back to the normal mode. Okay, so I'll go into the normal mode and let's do the lecture in the normal mode. Okay, so can you guys see slides now?
Yes, miss.
Okay, so if I do
Yes.
the, all right. So guys, if I do the lecture like this, if I do the lecture in this mode, you can see whatever the content written in the slides clearly, right?
Yes, miss.
Okay, all right. All right, guys. So then I will start off with the lecture. So I will start off with today's lecture. Yes, so this is your lecture 7 for this module, resource management in health and social care. Okay, so today these are the main topics that we will be discussing about. Okay, so in today's lecture, you will learn about these uh, two main topics. The regulatory system that underpins the service delivery, the process of inspection for health and social care services. Okay, so under each of these main topics, there will be several subtopics that we are going to discuss. Okay, but in terms of the main topics that you will be learning today, these are the two main topics that we will be discussing today. Okay, so first of all, we'll discuss the regulatory system. Okay, so the regulatory system means basically the regulatory bodies that underpins means supports. Okay, so the meaning of the word underpins means supports. Okay, so in this first main topic you will learn about the regulatory systems or the regulatory bodies that supports health and social care service delivery. Okay, and then in the second main topic, we will learn about the process of inspection, how inspections are carried out in the field of health and social care services. Okay, so yeah, so out of these two topics, this is the topic that we will be starting off with. Okay, so this is the first topic that we will be discussing today. The regulatory system that underpins service delivery. Yeah. Okay, so yeah, so here in this part, in this topic, we will be learning what are the regulatory bodies that supports health and social care services. Okay, so the regulatory bodies that support health and social care services. Okay, so that is what you will learn under this topic. Okay, so before we start discussing about what are the regulatory bodies that support health and social care services, first of all, we need to have a clear idea about what is regulation. Okay, so before we move on to discussing about regulatory bodies, we should gain an idea about regulation. Okay, so like we should learn what is regulation first before we move on to regulatory bodies. Okay, so first of all, let's discuss what is regulation. Okay, so guys, before I teach you, can I like hear from you guys? Can I hear your answers? Like, what do you think regulation is? Why do you think we need regulation? Like what kind of a thing is regulation as per your understanding? You can unmute and tell your answers, or else you can type in the chat as well. Yes, Taranga.
It is a rule that
Mm.
made of some authority
Okay, all right.
or some government or some kind of thing.
Okay, all right. So, yeah, so like, yes, that is another meaning for regulation. Yes, like I'm happy to see that you guys remember that we discussed about acts and regulations, right? Like in our previous lectures. So when we discussed about acts and regulations, like I told you guys that act is a rule which is like made by the parliament, which is passed by the parliament, and is regulation is something that makes you follow the act, right? So yes, it is a definition for regulation. But in today's lecture, we are not talking about that kind of regulations. Okay, so we are talking about regulations done by regulatory bodies. Okay, so yes, like what you said, regulation is a kind of a guideline made by the government or by the parliament. Yes, I can accept that definition for the word regulation. But the thing is, in today's lecture, um, yeah, Metni has an answer as well. A rule or directive made and maintenance by an authority. Yes, like, yes, I can accept that definition for regulation. That's right. Um, but the thing is, in today's lecture, we are not talking about those kind of regulations. We are going to talk about the regulation process done by regulatory bodies. Okay, so I'm so happy to hear that like you guys remember the previous topics that we discussed about. Okay, so but however, in today's lecture, we are not talking about those regulations that we discussed in previous lectures. What we discussed today, um, other what we discussed today is the regulation process done by regulatory bodies. Okay, so the regulation that we discussed today has a different definition. Okay, so today we are discussing about the regulation process done by regulatory bodies. Okay, it has a different definition. Okay, so now let's see what is regulation. Okay, so regulation is something very important. It's a very crucial aspect in health and social care services. Okay, regulation is something really important in health and social care services. Okay, so because in health and social care services, you are dealing with older patients, you are dealing with sometimes you are dealing with children. Okay, so basically, like you are dealing with people who need medical help or some sort of help, right? You are dealing with patients, like or else with older people or children who need help. Okay, so like overall, you are dealing with people who need help. So your job is to provide support to these people. Okay, so that's why regulation is really important in health and social care sector, because in health and social care sector, we are basically dealing with people who need some sort of support. Okay, so to provide proper support to those people, regulation is really important. Okay, so yeah, so guys, regulation is basically something like supervising. Okay, so so for example, I mean the regulation that we are going to talk about today Okay, so I told you that we are not talking about those rules and regulations, the rules, acts and regulations today, right? I mean, in one of few of our previous lectures, we discussed about act and regulations. We discussed about acts and regulations, and in there I mentioned that regulation is a set of guideline. Is regulation is a guideline that makes you follow the acts. Okay, so today we are not talking about those kind of regulations. This regulation is different. Okay, so today we are talking about the regulation process done by regulatory bodies. Okay, so yeah, so when it comes to this regulation is something like supervision, something like supervising. Okay, so for example, when we are doing a research, there is a research supervisor. Um, so this research supervisor is the one who checks whether the student is doing the research properly or not, right? So if the student is kind of struggling with the research, they will give their advices and guidelines on how to improve the research, right? So that is
Follow up.
how,
No,
yes.
I think follow up.
Yes, yes, Janaka, that's a really good answer. Yes, that is the kind of regulation that we will be talking about today. Okay, so follow up or checking or like kind of supervising, like overseeing. Okay, so yeah, so even in a research, as I said just now, there is a research supervisor whose responsibility is to check, is to follow up on the research and to check if the research is going properly or not, right? And even when it comes to workplaces, even when it comes to work, we have supervisors to oversee us, right? So we discussed a lot about supervision in our previous week's lecture, right? How supervisors are evaluated and what are their responsibilities, how supervision sessions take place, and we discussed about those forms also. Okay, so yeah, so even in workplaces we have supervisors, and their job is to oversee. Is their job is to follow up and oversee if the work is being done properly or not. Okay, so basically, in supervising, what happens is someone oversees us, right? Someone checks whether we are doing our job correctly or not. That is what happens in supervising. Okay, so the supervisor sees if we are doing things properly or not. Okay, so s- the same thing applies in regulation as well. Okay, so regulation means that is what happens in regulation as well. In regulation, someone is checking if you are doing your service properly or not. Like if you are doing your health and social care services properly or not. Okay, so this is being overseen or this is being followed up by someone. Okay, so someone is checking, like in regulation, someone is checking whether you are providing your health and social care services properly or not. Okay, so who is this someone? Okay, so this someone are the regulators or the regulatory bodies. Okay, the the person or the people who checks whether you are providing the services properly or not is called regulator or regulators or regulatory bodies. Okay, so a regulator or a regulatory body, a regulator or a regulatory body will check whether you are providing health and social care services properly or not. Okay, so that is what happens in regulation. Okay, so in any field, you guys know that not only in health and social care sector, in any sort of a field, we have rules and we have standards, right? Um, so like if you take, I mean, let's keep health and social care services let's keep health and social care sector aside for a while. If you take another field like manufacturing, food manufacturing, there are some standards, like there are SLS standards and there are good manufacturing practices. So likewise, there are some standards that you should meet during the manufacturing process. And even if you take pharmaceutical sector, there are certain standards that you should meet during the manufacturing process of those pharmaceuticals. Okay, so likewise, each and every field has a set of standards that the people need to follow. The people in the workplace should follow these standards. Okay, so the same thing applies for the health and social care sector as well. Even in the health and social care sector, we have some standards, we have some rules and guidelines, and these rules and guidelines and these standards should be followed in the workplace. Okay, all the people who are working in the workplace should work according to these standards or according to these rules or guidelines. Okay, so the regulatory bodies or the regulators will check if you guys are working according to these standards or not. Okay, so if you are working according to the standards, then no problem, no issues. But if you are not working according to the standards, if you are not complying with the standards, then that is a problem. Then the regulatory body will take some actions against your company. Okay, so we will discuss about those kind of actions towards the end of the lecture. Okay, so for now, I just wanted to give you guys a brief idea about regulation and what happens in regulation. Okay, so now you guys know that regulation is about someone following up and someone checking whether you are doing your job properly or not. Okay, so the person, so this someone who checks whether you are doing your job properly or not is called a regulator or the regulatory body. Okay, so the regulators or the regulatory bodies will check if you are doing your job properly or not. Okay, so the regulatory body or the yes, Taranga.
Is it like a audit man?
Yes, it's something like an yeah, it's something like an audit. Um, who asked that question? Tilani, right? I think I said Taranga, sorry. Tilani is the one who asked the question, right?
Yes,
Okay.
Miss Gilani.
Okay, all right. So yeah, so it's something like, yeah, it is something like audit. Uh, but I mean, I can say it's something like audit, but it is not an audit. Okay, so audit has a different definition and audit is something else. Um, but regulation is something else. Okay, so for example, if you take an audit, audits are done by the people who are some, I mean, there are certain times where like audits are done by people who are from who are not from the workplace, right? Like sometimes different like uh, like different agencies and different like people from like different agencies come and do audits. Okay, so those are called external audits. But there are certain times where audits happen internally as well, right? Like the people in the people who are working in the workplace audits their own workplace. Okay, so for example, if it's a manufacturing company, the QA department will audit the production department. Likewise, okay, so audits can happen internally and externally both. Okay, so when it comes to regulation, regulation is always done by external bodies. Okay, so when it comes to audits, audits can be done by external parties and sometimes it can be done by internal uh, workers as well. The audits can be done by people who are working in the workplace as well. As I just mentioned you guys, like the QA, for example, the QA department can conduct an audit on the production department. Okay, so audits can yes,
I
Janaka.
think, ma'am, it is a daily evolution based on the a set of rules, no?
In audits.
Yeah, no, I think regulations means a daily evolution based on a set of rules or criterias, follow
Mm,
criterias
okay, so
or jumps regulation, any regulations, follow any regulations.
okay, so regulations do not happen daily, Janaka, because uh, like regulation is kind of the regulatory. So you guys will learn about the regulatory process or the inspection process today. So it is kind of a lengthy process. It takes time, and it takes time to plan and regulatory. I mean, the planning stage also requires some time. So regulatory process is kind of a lengthy process. So we can't do it daily. So regulation is not something happens daily, but like maybe like once a year. Okay, so the regulatory body will check your company maybe like once a year or maximum like twice a year. Okay, because like in the regulatory
No, ma'am,
process.
sorry, ma'am. I mean, if we want to held good pathway on company or any organization, we should follow rules and regulations daily.
Yes, yes, exactly. Yes, that is true. Yes, um, exactly. You should follow standards, rules, or whatever the guidelines daily, like each and every day. Uh, to so if you follow those rules and set of guidelines each and every day, like if you do it as a daily practice, then the regulatory body or the regulators will not have anything bad to point out in your company, so you will not be in trouble. That is right. Okay, so regarding the question that you guys asked, regarding the question that Tilani asked about the audits, so audits, yes, regulation is something like audit, but not exactly an audit. Okay, because as I mentioned, audits can be done by internal people as well. For example, like a QA department can audit another department, right? But when it comes to regulation, regulation is never done by internal people. Okay, so regulation is always done by outside regulatory bodies like external parties. Regulation is never done by internal people. It is always done by external regulatory bodies which are located outside the company. Okay, so regulation is always an external process. Okay, so that is the difference. So I can say even in audits, what happens is the auditor checks whether the things are done properly or not, right? So in regulation also, the regulators check whether everything is done properly or not. Okay, so in that aspect, I can say yes, it's something like audits, but not. But there is a very clear difference between regulation and audits. Okay, so yes, you can say regulation is something like audits, but not exactly an audit. Okay, so there are clear differences between these two. All right. So guys, now you know regulation is about checking whether the job is done properly or not. So to check this, we have regulators or regulatory bodies. The people who are checking the things are called regulators or the regulatory bodies. Okay, so these are the roles of regulatory bodies. Okay, so even in health and social care sector, we have regulatory bodies who check whether the services are provided correctly or not. Okay, so these are the roles of health and social care related regulatory bodies. Okay, so the regulatory bodies are there to protect health and social care uh, consumers from health risks, to protect people from health, to protect service users or the customers from health risks, and also to provide a safe working environment to the health and social care workers who are working in the workplace, and also to ensure the health and welfare of public by health and social care programs. Okay, so these regulatory bodies sometimes carry out health and social care related programs to ensure the health and welfare of the public, of the general public. Okay, so these are the roles of regulatory bodies. Okay, so regulation works at all levels. Okay, and the regulatory standards are developed by government and private organizations as well. Okay, so regulation is something that happens at all levels. Okay, so all levels means regulation is not something limited only to big companies. Okay, so even small companies, even the startup companies, even the startup companies should undergo regulation. Okay, so that is the meaning of this sentence. Regulation works at all levels. All levels means regulation should happen in all sorts of companies, in all sorts of workplaces. Okay, it's not something limited only to big companies. Even the newly started up companies or organizations should also go through regulation. Okay, and the regulatory standards. Okay, so the regulatory standards means the standards that you need to follow on a daily basis, right? The rules or the guidelines that you need to follow on a daily basis. Okay, so these standards are developed by, sometimes these standards are developed by the government, and sometimes these standards are developed by private organizations. Okay, so standards are developed by government and private organizations as well. That is how the standards are developed. And like we need to make sure we follow these standards on a daily basis, on a regular basis. Okay, so yeah, so regulation is necessary. Regulation is needed to supervise the health and social care sector and ensure that the service users get a proper um, service from the health and social care uh, service providers. Okay, so that is the reason why we need regulation in health and social care sector, to make sure that your patients or your visitors or whoever your customers receive a good quality care, a good quality service from the service providers. Okay, so yeah, so to check whether to check the health and social care sector, we have regulatory agencies. Okay, so these regulatory agencies will check health and social care practitioners and health and social care workplaces and health and social care practitioners. Okay, so practitioners means people. Okay, so the regulatory agencies will check both. They will check people, they will check practitioners, and they will check the facilities. Facilities means like organizations, companies, basically workplaces. Okay, so the regulatory agencies will check health and social care practices and health and social care workplaces uh, to see whether these people and these workplaces to see whether these people or these workplaces follow the necessary standards or not. Okay, so that is one thing done by the regulatory agencies. Okay, and then inform the government about changes in the way the health and social care industry operates. Okay, so the regulatory agencies can give their feedback to government as well. Okay, so these agencies can help the government to make health and social care related decisions as well. Okay, so if they think there should be some changes done in the health and social care industry, they can give these ideas to the government. They can inform the government about it. Okay, and they can help the government to make health and social care related decisions. Okay, and the regulatory agencies will also ensure the safety standards and improve the quality of the service provided by the health and social care workplaces as well. Okay, so these are few things done by the regulatory agencies. Okay, so now we can see the functions of a regulator. Okay. All right, so guys, yeah, so since you know what is regulation now, so I explained to you guys what is regulation and what kind of things happen in regulation. Okay, so regulator is the person or the entity or the body who carries out regulation, the person who sees, the person who follows up and checks whether things are being done properly or not. Okay, so now can you like I will give you a few seconds. Like can you think about the functions of a regulator? Like before I teach you the functions, can you guess the functions of a regulator? Like what kind of things are done by regulators? Okay, so I'll give you a few seconds uh, to think about the functions. Okay, so you can unmute your mic and tell the answers to me, or else you can type in the chat as well. Okay, so Tilani, can you give an example for regulation in health and social care? Of course, Tilani, we will talk about lots of examples. Okay, so in these few slides, we are just learning about the regulation process and the regulators. Okay, so from here onwards, from the slide 8 onwards, I will give you lots of examples for regulators, the health and social care regulators. Okay, so here you will learn about regulators in the UK. Okay, because I thought of teaching you about the regulators in the UK because this diploma is also a UK qualification. So here onwards, you will learn about lots of health and social care regulators uh, avail available in the UK, in United Kingdom. Okay, so there are some, let me show you. Okay, so Ofsted there's a regulator called Ofsted in England and care Inspectorate Wales, the Regulation and Quality Improvement Authority, CQC, care inspectorate. Okay, so these are some regulators, health and social care regulators in the UK. Okay, so you guys will learn about these regulators um, a few minutes later. Just for now, we are just uh, talking about the regulatory process. Okay, so I'll give you a few seconds to think about the functions of a regulator. So guys, can you tell me what can be the functions or what can be the roles of a regulator? Like since you guys know what is regulation now, can you guess the functions of a regulator? Protection of public interest, monitoring compliance with establishment. Yes, Smithney, that's a good job and thanks for posting it on the chat. Yes, those are some functions done by regulators. Okay, so a regulator, like a regulator is basically a person or a set of people who keeps track um, on how well the health and social care system is complying with the requirements or the standards. Okay, so these regulators check whether the health and social care workplaces or the health and social care companies or the organizations comply with the legal requirements and standards or not. Okay, so a regulator is someone who checks whether someone who checks whether you are complying with the health and social care related legal requirements and standards. Okay, so they basically check whether you are complying with the standards or not, whether you are complying with the legal requirements or whether you are complying with the legal requirements and the standards or not. Okay, so yeah, other than that, the regulators also lay down standards for technical operations as well. Okay, so like the regulators will keep track on the technical operations that happen in the workplace as well, and if they find any non-compliance means if the regulators find out that you are not complying with the standards or if you are not complying with the legal requirements, there will be penalties for that. Okay, you will be penalized for non-compliance. Okay, so the regulators have the power to penalize you for non-compliance, for not following the standards or legal requirements. Okay, so when it comes to regulation, all these things, cost effectiveness, performance analysis, tariff evaluations. Okay, so tariff means an amount of money that you have to pay for imports or exports. Okay, so tariff means that tariff is an amount of money that you have to pay uh, either for exports or for imports. Okay, so those evaluations, tariff evaluations and regular reviews, okay, and setting up mechanisms. Okay, so all these things are components of parts of regulation. Okay, cost effectiveness, performance analysis, tariff evaluations, regular reviews, setting up mechanisms, all these things are components of regulation. Okay, so the regulatory body or the regulators also advise the government on partnerships and they help to shape policies and other related matters. Okay, so as I mentioned just a few seconds ago, regulatory bodies or regulators advise the government as well. They advise the government um, to make decisions and even sometimes to make rules and policies. To make rules and policies also, sometimes these regulators help the government. Okay, so helping the government to make decisions or to create new policies or rules. These are also some functions done by the regulatory bodies or regulators. They advise the government um, on private-public partnerships in health and social care sector, and they also help to create new policies or rules or guidelines or whatever as well. Okay, so helping the government is another function done by regulators or regulatory bodies. Okay, so so when it comes to regulatory bodies, there can be several types of regulatory bodies. Okay, so statutory bodies is one type of regulatory bodies. It's a type of regulatory body. Okay, so there are several types of regulatory bodies and statutory bodies is one type of regulatory bodies. Okay, so these statutory bodies, so now what do statutory bodies do? Okay, so statutory bodies publish quality standards, offer accreditation, and offer continuing education and training for health and social care professionals. Okay, so these are the things done by statutory bodies. Okay, so they publish quality standards and they offer accreditation and they offer education and training programs for health and social care professionals. Okay, so these are the kind of things done by kind of roles or functions done by statutory bodies. Okay, so these bodies regulate services or professionals. Okay, so the services and the professionals are regulated by these statutory bodies. Okay, and accreditation agencies is another type of regulatory body. Okay, so accreditation agencies are also regulatory bodies, a special kind of a regulatory body. Okay, so what do accreditation agencies do? Okay, so accreditation agencies provides, as the name itself, accreditation bodies provide accreditations. Okay, so you guys might have heard of accredited laboratories, right? Accredited laboratories, accredited companies. Likewise, okay, so like you guys might have like even in like notices or like advertisements, like sometimes people mention our laboratory, our medical laboratory is accredited. Likewise, okay, so yeah, so this accreditation is provided by accreditation agencies. Okay, so these are the agencies that provide accreditation to companies, workplaces, laboratories, or whatever. Okay, so if the companies or these laboratories or these organizations, like if your company or the laboratory or the organization follow proper standards, like so the standards, the kind of standards that you need to follow differ according to the field, right? In food manufacturing sector, you have a set of standards valid for food manufacturing, but those are not the standards that you should follow in health and social care sector, right? Because in health and social care sector we have another set of standards, and in pharmaceutical sector you have another set of standards, and in microbiological in microbiology field you have another set of standards. Okay, so the kind of standards, the standards differ according to the field that you are working in. Okay, so in this diploma, we are talking about health and social care services, right? So in health and social care sector also, there's a set of standards which are there are some standards which are valid, valid for the health and social care sector, right? So we have standards which are specific for the health and social care sector. Okay, so if your company or if your laboratory complies with these standards, then these agencies will provide accreditation to your company or to your laboratory. Okay, so if you're not complying with these standards, they will not provide the accreditation. Okay, so the importance of accreditation is like accreditation helps you to gain your customer base basically, because even like, I mean, for example, if you need to do a medical examination done, we prefer to get it done in an accredited laboratory, right? We prefer, as people, as general public, we prefer to get it done by an accredited laboratory rather than a normal laboratory, right? So accreditation helps you a lot to gain a good reputation in the society, and also to gain your customer base, to gain your client base. Okay, so that is the importance of accreditation. Okay, so this accreditation is provided by accreditation agencies for following necessary standards or guidelines. Okay, so yeah, so here we can learn about the pros and cons of regulation. Okay, so pros means advantages and cons means disadvantages. Okay, so you guys might be thinking whether there are any disadvantages in regulation. Okay, because I mean, up to now we were discussing the importance of regulation and all the good things about regulation, right? So if you guys are thinking whether there are any disadvantages in regulation, yes, there are some disadvantages as well. Okay, so now let's see what are the advantages of regulation and what are the disadvantages of regulation. Okay, so here in this green box over here, you can see the advantages. Okay, so the regulation helps you to provide better working conditions and protect human rights and assurance of tax revenue, and the safety is improved. The safety of the workplace is improved because of the regulation process, and and the minimum qualification levels of the people, like when you are hiring people to your workplace, they should have a minimum qualification level for their for the jobs that they have applied for, right? Like even when you're applying for a job, you should, like in the job advertisement, they have mentioned what is the minimum qualification level that you should have to be eligible for this job. Okay, so likewise, there are minimum qualification levels required uh, by the employees to hire you, right? You should have that minimum qualification level to be eligible for the job. Okay, so the assurance of minimum qualification levels is another advantage of regulation. Okay, so because the regulators will tell you that, like when you are hiring for these kinds of jobs, this qualification, the people, like if the people who like the people who are being hired should have at least this qualification for this job. uh, the people should have at least this qualification for this people should have at least this qualification. Likewise, the regulators will tell you what are the minimum qualification levels that should be that the people should have to get hired for the job. Okay, so assurance of minimum qualification levels is another advantage, and provide social security for the people, and the health of the general public is being improved, and there can be some environmental benefits of regulations. Okay, so and because of regulation, people will learn how to be accountable, how to be responsible for their own actions. Okay, so these are some advantages of regulation. These are the good side, the brighter side of the brighter side of regulation. Okay, so the advantages of regulation. Okay, so now we can have a look at the disadvantages, the darker side of regulation. Okay, so now what can be the disadvantages of regulation? Okay, so here in this brown color box over here, you can see the disadvantages of regulation. Okay, so the first thing is regulation. As I mentioned to you, I mentioned this just few minutes ago also. The regulatory process, the regulation process is a very lengthy process. Okay, so it's not a short and sweet process, it is a lengthy process. Okay, so regulation can be time consuming. Regulation can consume a lot of time. And regulation requires large amounts of administrative work, right? So like there will be a lot of work, there will be a huge workload for the administrative people in the workplace. Okay, so regulation requires a huge amount of administrative work. Okay, so the workload for the administrative staff will be high. Okay, and small businesses might suffer because of regulation. Okay, because like if the regulators found out that these small businesses are not complying with the standards, they will take some actions, right? So actions means sometimes like the companies will get fined. Okay, so if because like if a big company gets fined, it's not a big deal for them, right? Because they are very much they are big companies and they are very much financially stable. But if if the same thing happens to a small business, to a small company, they will suffer from it because they are small companies, they are small businesses, they are not that much stable in terms of their finances, they are not that much financially stable, right? So paying fines can be very difficult for them. Okay, so small businesses or small companies may suffer from regulation. Okay, and regulation can be costly. Sometimes uh, it costs you a lot of money sometimes. And yeah, and if the regulation is not done properly, if the regulation is flawed regulations may do more harm than good. Okay, so if the regulation is not done properly, it will be very harmful for the company. Okay, so if the regulatory body was unable to do the regulation properly or correctly, um, it will do a lot of harm to the company which is being regulated. Okay, and due to regulation, sometimes innovations or the technological progress will be slowed down, and sometimes the competitiveness will also get hurt because of the regulation, and the regulation will also sort of interrupt the freedom in the workplace, because freedom means being able to do whatever the things you want in whatever the ways that you want, right? So I mean, like that is how you um obtain freedom, right? Like freedom means you can do whatever you want in whatever the way you want. But when it comes to regulation, you do not have that freedom because you always need to follow a set of standards or set of rules. Okay, so regulation might interrupt the freedom of the workplace, of the company as well. Okay, that is another disadvantage. And sometimes people can get annoyed with a lot of regulations. People might not tolerate certain regulations, and then when companies get penalties, when the companies get penalized for not following standards or guidelines, that creates a negative impact on the company, right? Because when a company is penalized, it will lose its customers, and the reputation in the society will be kind of tarnished as well. The reputation will be the reputation or the respect that the people have for the uh, company will be tarnished. Okay, so the penalties can create a negative impact on the companies. Okay, so these are some disadvantages of regulation. Okay, and in the slide you can see both advantages and disadvantages. Okay, so now we can see what are the regulators in the United Kingdom. Okay, so so here we are talking about health and social care related regulators. Okay, so why are we learning specifically about the regulators in the UK? Because this autumn is a UK qualification. Okay, so even in the syllabus, you guys are supposed to learn about the regulators, not in Sri Lanka, but the regulators in the UK. Okay, so here, let's see who are the regulators, or else what are the regulatory bodies in the United Kingdom. Okay, so here we are talking about health and social care related regulators, like regulators or the regulatory bodies related to health and social care sector in the United Kingdom. Okay, so the UK healthcare system is supported by the Department of Health and Social Care, DHSC. Okay, so the UK healthcare system is led and supported by these entities: Department of Health and Social Care, NHS England, and Public Health England, PHE. Okay, and then this NHS. Okay, NHS means the National Health System. Okay, NHS is regulated by 10 service regulators. Okay, so NHS is regulated by 10 service regulators. And who are these regulators? Okay, so these are the names of these regulators. Okay, Care Quality Commission. In short, we call it CQC. You will learn a lot about CQC in today's lecture. Okay, so Care Quality Commission or the CQC, and Medicines and Healthcare Products Regulatory Agency, the United Kingdom Accreditation Service, the Environmental Agency, the Human Fertilization and Embryology Authority. Okay, so these are few of the regulators who regulate the national health system. Okay, so the NHS is regulated by 10 service regulators, and here are some of those 10 service regulators. You can't see all the names, you can't see the names of all the 10 service regulators here, but here you can see a few of them. CQC, Healthcare Products and Regulatory Medicines and Healthcare Products Regulatory Agency, UK Accreditation Service, Environmental Agency, Embryology Authority. Okay, so these are some of the regulators who regulate the national health system. Okay, so CQC. Okay, so CQC means Care Quality Commission. Here you can see the full form, Care Quality Commission, or CQC. Like CQC is the short form for Care Quality Commission. Okay, so CQC is the main healthcare regulator in England. Okay, so CQC is the main healthcare regulator in England, and it is responsible for registering, inspecting, monitoring, and rating healthcare services in England. Okay, so yeah, so for healthcare professionals in UK, there are 8 regulators to regulate the healthcare professionals in UK. Okay, so the General Medical Council, General Dental Council, General Optical Council, General Pharmaceutical Council, the Health and Care Professions Council, and the Nursing and Midwifery Council. Okay, so these are the regulators of healthcare professionals. Okay, so there are 8 regulators to regulate healthcare professionals in the United Kingdom. So here, these are some of them. These are some of those regulators who regulate healthcare professionals, people who do healthcare related jobs. Okay. Okay, so these bodies, like these entities, regulate the practice of healthcare by professionals. Okay, so these regulators these regulators basically regulate the people or the professionals. Okay, so these regulators sometimes provide education and training for these professionals. Okay, and revalidation, investigation, they sometimes investigate the professionals, and sanctioning them as required. Sanctioning means punishing. Okay, so if the professionals do not meet certain standards, like not only workplaces and companies, even the professionals, even the people need to, even there are some jobs, especially when it comes to healthcare sector, like doctors, nurses, midwives, likewise, and the medical officers. Okay, so these kind of jobs, the people who are doing these kinds of jobs should comply with certain standards, right? So if you do not comply with the standards, you will be punished. Okay, so sanctioning means punishing. Okay, so these regulators, so here you saw some of the regulators that regulate healthcare professionals. So these regulators will regulate the professionals, and if they found out that the professionals are not meeting the standards, they will sanction the profession. These regulators will sanction these professionals. Okay, so sanction means punish. Okay, so the professionals will be punished by these regulators if they do not follow the necessary standards. Okay, so all these 8 regulators. So I told you that to regulate healthcare professionals, there are 8 regulators. Okay, so all these eight regulators are overseen by the Professional Standards Authority, PSA. Okay, so this is the authority that oversees all these 8 regulators. Okay, so all these 8 regulators are overseen by the PSA authority, Professional Standards Authority in UK. Okay, so yeah, so basically the main role of a regulatory body is to ensure the safety of the public by making sure that people and companies work according to necessary standards. Okay, so that is the main role of a regulatory body, to safeguard the public, to ensure the safety of public by ensuring that the professionals or the companies work according to necessary standards. Okay, so yeah, so the regulatory bodies ensure the safety of public through a number of primary functions. Okay, so these here in this picture, you can see the primary functions or the main functions done by the regulatory bodies to ensure the public safety. Okay, so the regulatory bodies do these functions, do these things, they do these functions to ensure the public safety. Okay, so what are the primary functions done by the regulatory bodies? Okay, so here you can see the primary functions. Okay, so the first point over here, keeping and maintaining registers of health and social care professionals who are fit to practice in the UK. Okay, so here we are talking about the regulatory bodies in the UK, right? We were talking about the regulators in the UK. Okay, so these are the primary functions of the um, regulatory bodies in UK. Okay, so these regulatory bodies maintain registers. Okay, so these registers contain information about health and social care professionals. Okay, so you guys remember the registers that we had at school, right? So it is this is also something like that. Okay, so the regulatory bodies maintain registers of health and social care professionals who are suitable, who are fit to practice in the UK, who are qualified to practice in the UK. Okay, and these regulatory bodies also set and promote standards of conduct, ethics, and competence. Okay, and these regulatory bodies also provide education and training programs for the health and social care professionals. And these regulatory bodies also deal with concerns, the patient's concerns, okay, and public concerns. Okay, so whenever the patients or the public raise their concerns, these regulatory bodies gather these concerns from patients and public, and they deal with these concerns. They analyze these concerns and they see what can be done to address these concerns. Okay, and another main function done by the regulatory body, done by the regulatory bodies, is that it's that these regulatory bodies will remove professionals from its registers, and they will prevent these professionals from practicing if they found out that these professionals are not complying with the standards. Okay, so if these regulatory bodies found out that these health and social care professionals are not complying with the standards, they will immediately remove these professionals from their registers and prevent them from practicing in the United Kingdom. Okay, so that is another function, another main function done by the regulatory bodies in UK. Okay, so guys, that's all about the regulation process. Okay, so we discussed what is regulation. We discussed what are the advantages and disadvantages of regulation. And we discussed about regulatory bodies in UK, and we discussed about the primary functions, the main functions done by the regulatory bodies. Okay, so that's all about regulation. Okay, so before we move on to the next topic, may I know whether you guys have any questions to ask? Like, is everything clear about regulation, or are there any questions?
Clear, Miss.
All right. Okay, so can I hear from others as well? Just to make sure that everybody understood.
Yes,
No
Miss.
issue, ma'am.
Okay, all right. All right, guys. So then we can move on to our next main topic for today. The process of inspection for health and social care services. Okay, so we discussed a lot, uh, uh, a lot of information about regulation, right? So in regulation, I told you that regulators will uh, inspect whether you are doing, the regulators will inspect whether you are doing the job properly or not, right? So now we are going to learn how this inspection takes place, how the process of inspection takes place. What are the steps in the process of inspection? Okay, so here onwards you will learn about how inspection happens in health and social care services. Okay, so guys, just give me 1 second. All right, so guys, can you hear me again?
Yes, ma'am.
Okay, all right. Okay, so yeah, so in UK, each of the 4 UK nations. Okay, so 4 UK nations means the 4 parts of United Kingdom. Okay, so like you guys know that there are like 4 parts of United Kingdom, right? United Kingdom is made up of England, Scotland, Wales, and Northern Ireland. Okay, so those are the 4 parts of UK: England, Scotland, Wales, and Northern Ireland. Okay, so all these 4 parts, all these 4 UK nations means these 4 parts: Scotland, Wales, Northern Ireland, and England. Okay, so all these 4 parts has at least one regulatory body that oversees the provision of care services. Okay, so all these like in each part there is at least one regulatory body to oversee the provision of care services. Okay, so that is the meaning of this sentence. Okay, so like there are 4 UK nations. There are 4 parts in UK, which are England, Scotland, Wales, and Northern Ireland. So each part has at least one regulatory body to oversee the health and social care services in that particular part. Okay, so yeah, so the regulation of social care services helps to make sure that the care offered to the people is safe, caring, and compassionate. Okay, so here you can see a list of regulatory bodies who check that the national standards are being met. Okay, so most social care services are inspected by the regulatory bodies who check that the national standards are being met. Okay, so here in these 5 points, you can see a list of regulators in United Kingdom. Okay, so these are the regulators related to health and social care. Okay, so here you can see a list of health and social care related regulators in United Kingdom. Okay, so Ofsted. Okay, Ofsted is one regulator in UK. Okay, so they inspect children's homes and foster care services in England. Okay, and Care Inspectorate Wales. That's another regulatory body. They inspect care services for adults and children in the Wales. Okay, and the Regulation and Quality Improvement Authority. That is another regulatory body. They inspect the services for adults and children in Northern Ireland. Okay, and the Care Quality Commission, CQC. It's another regulatory body in UK. They inspect most adult care services in England. Okay, and the Care Inspectorate is another regulatory body. They inspect adults and children's care services in Scotland. Okay, so here these are the main health and social care related regulators which you can see in United Kingdom. Okay, so when these regulators, okay, um, so you guys just learned about the functions of regulators, right? So the main function of a regulator is to check whether the services are being provided properly or not. Okay, so when these regulators like how to say that, when these regulators like when these regulators check whether the companies and the professionals are working according to standards or not, these regulators pay attention to these points. Okay, so like when in the process of regulation, these regulatory bodies. Okay, so we discussed about certain regulatory bodies over here, right? Ofsted, Care Inspectorate Wales, the Regulation and Quality Improvement Authority, and CQC, Care Quality Commission, and the Care Inspectorate. Okay, so in the process of regulation, these regulators, okay, so which I highlighted in red over here. Okay, so these regulators pay attention to these points. In the process of regulation, these regulators pay attention to these points. Okay, so these regulators will check how the service is keeping people safe, how the health and social care service. So these regulators inspect certain professionals and certain companies, right? So when they inspect professionals and companies, they will check how their services are keeping people safe. Okay, and they will also see how the service is involving people in decisions about their own care. And the regulators will also see how the service, how the company recruits, trains and supports their staff. And the regulators will also check how the service promotes independence, respects the dignity of an individual and ensures their well-being. Okay, so the regulators in the process of regulation, like when they are inspecting professionals and companies, these regulators will pay attention to these areas. Okay, so now we are going to talk in detail about this regulator over here, Care Quality Commission, or CQC in short. Okay, so let's talk about the types of CQC inspections. Okay, so there are several types of inspections carried out by the CQC or the Care Quality Commission. Okay, so CQC is a UK health and social care regulator, as we discussed earlier. Okay, so there are 4 different types of inspections carried out by the CQC. Okay, so here you can see the names of these 4 different types of inspections. Okay, comprehensive inspections, focused inspections, targeted inspections, and combined inspections. Okay, so these are the 4 types of inspections carried out by the CQC. Okay, so comprehensive inspection is an in-depth inspection. Okay, so in comprehensive inspections, you are inspecting things in detail. It is an in-depth inspection. You are inspecting in detail you are inspecting about things in detail. Okay, so it's an in-depth inspection. So focused inspection is somewhat different from comprehensive inspections. Okay, so in focused inspections, you do not inspect things in detail. Instead of inspecting things in detail, you look at a particular area or areas that have been flagged up to the CQC. Okay, so this is the main difference between comprehensive inspections and focused inspections. Okay, so in comprehensive inspections, you inspect things in detail, in depth. Okay, comprehensive inspections are in-depth inspections. And in focused inspections are not in depth. In focused inspections, you inspect only a particular area or a particular areas that have been flagged up to the CQC, that have been like some particular area or particular areas flagged up means like perceived as important. Okay, so flagged up means that. Okay, so like focused inspections are not in-depth inspections. In focused inspections, you look only at a certain area or a certain set of areas which are considered as important by the CQC. Okay, so that is the main difference between comprehensive inspections and focused inspections. Okay, so now we are going to learn about the process of inspection. Okay, so now guys are going to learn about how CQC carries out inspections. What are the steps of this inspection process? Okay, so here from this slide onwards, you guys are learning about the process of inspection. The process of inspection at CQC. So guys, the process of inspection. So this is the process that is carried out by the CQC. Okay, so this process that you are learning here is valid only to the CQC. Okay, so like different regulators have different processes. Okay, so the process of inspection is different from one regulator to another regulator. Like different regulators have different processes of inspection. Okay, so here what you are going to learn is you are going to learn the process of inspection carried out in CQC. Okay, so this is the process of inspection done in CQC. Okay, so this process is valid only to the CQC. Okay, so do not misunderstand that this process is valid for every regulator. Okay, so this process is valid only to the CQC. Okay, so different regulators have different processes. Okay, so here in this lesson we are learning about the process of inspection done by CQC. So this is valid. This particular process is valid only to the CQC. Okay, so do not misunderstand that this is the process done by all the regulators. That's not the case. Different regulators have different processes. This process is valid only to the CQC. This is the process of inspection in CQC. This is how CQC carries out inspections. Okay, so this process that I'm going to teach you is valid only to the CQC. Okay, so how CQC carries out inspections or the process of inspection at CQC. Okay, so in this, so we can actually break down this process. Okay, we can break down the CQC inspection process into 4 steps, into 4 stages. Okay, so the first stage is planning stage, planning the inspection. And the second stage is the start of the visit. The third stage is gathering evidence. And the fourth stage is feedback. Okay, so these are the 4 stages of the inspection process of CQC. Okay, so now let's see what happens in each stage. Okay, so stage number 1, planning the inspection. Okay, so guys, give me just 1 minute. Hi guys, can you hear me again?
Yes, Miss.
Okay. All right. So now we will discuss about the process of inspection. Okay. So how CQC carries out inspections. Okay. So as I told earlier, there are 4 stages of inspection: or planning the inspection, the start of the visit, gathering evidence, and feedback, giving feedback. Okay. So first of all, let's see what happens in the first stage, which is planning the inspection. Okay. So what happens in the planning stage? Okay, so during the planning stage, CQC will collect these information. Okay, so this during the planning stage, CQC will collect this information. Okay, so they will collect the comments that they have received from phone calls, letters, and emails, or through forms, and they will also collect information from local health watch and other organizations, and they will also collect information from activities that they have planned to encourage people to give feedback. Okay, so they have collect information from the activities that they have introduced to people as well. And also they will gather some information from the staff who raise concerns, and from the care provider. Okay, so these regulators are inspecting care providers, right? So the CQC will collect some information from the care provider that they are going to inspect as well. Okay, so they will, during the planning stage, the CQC will collect all these sorts of information. Okay, so yeah, and during the planning stage, they will plan their inspection team as well. Okay, so many of the CQC inspection teams include specialists such as clinicians and pharmacists. Okay, but there are some people who are experts by experience as well. Okay, so this is the composition of a CQC inspection team. Okay, so most of the inspection teams have clinicians and pharmacists. In addition to clinicians and pharmacists, there can be people who are experts by experience as well. Okay, so these experience experts are the people um, who have used care services before, or else who have cared for someone else. Okay, so these experts by experience are the people who have used care services before, or who have provided care for someone else. Okay, so during the planning stage, the size of the inspection team is also decided. Okay, so the size of the team actually depends on the type of service that CQC is inspecting. Okay, so for example, if the CQC is inspecting an NHS trust, the inspection team will have up to 50 members. Okay, but if the CQC is inspecting a care home, if the CQC is inspecting a care home, a single inspector and an expert by experience is enough for the inspection team. Okay, that means only 2 people is enough for the inspection team if the CQC is inspecting a care home. Okay, but if the CQC is inspecting an NHS trust, then the team should ideally have up to 50 members. Okay, so the size of the inspection team depends on the type of service, the type of workplace that the CQC is inspecting. Okay, so the size of the team will also be decided during the planning stage. Okay, and then the CQC, once they complete the planning stage, the CQC will proceed to the next stage, the second stage, which is the start of the visit. Okay, um, so once they finish the planning stage, this is the second stage, the second step, the start of the visit. Okay, so at the start of the inspection, the inspector or the inspection team meet the senior staff of the workplace that they are going to inspect. Okay, so I mean, they are going to inspect a certain workplace, right? So the inspection team or the inspector will meet the senior staff of that workplace that they are going to inspect. Okay, so during this meeting, the inspection team will explain these points to the senior staff members of the workplace. Okay, so during the meeting, these points will be explained to the senior staff members of the workplace. Okay, so they will explain, the CQC will explain who the inspection team are, like how the how the inspection team is made, what are who are the people in the inspection team. Likewise, they will give a brief introduction to their, they will briefly explain their inspection team to the senior staff members of the workplace. Okay, and then what is the scope and the purpose of this inspection, and how the findings will it be communicated. So at the end of the inspection, you get some findings, right? So how these findings will be communicated. Okay, so these points will be explained by the inspection team to the senior staff members. Okay, so usually the inspections begin with a presentation by the care provider. Okay, so care provider means the workplace that is being inspected. Okay, so the care provider will give a presentation. Okay, so in this presentation, the care provider will give their own view of their performance. Okay, so this is something like a self-reflection. Okay, so care provider will give at the beginning of the inspection, the care provider will give a presentation, and in the presentation, the care provider provides their own view of their performance. So they are reflecting on their own performance. Okay, so it's something like a self-reflection. The care provider is reflecting on their own performance in this presentation. Okay, so that is what happens in the start of the visit, in the start of the inspection. Okay, and gathering evidence. Okay, so gathering evidence means what happens during the inspection process. So this is the start of the inspection, right? So once they finish this stage, the CQC proceeds to the next stage, which is gathering evidence. So gathering evidence means whatever the things that happen during the inspection process. Okay, so yeah. So during the inspection process, the inspection team collects evidences. The team collects proofs. Okay, so how do they collect evidence? How do they gather evidence? Okay, so this is how they gather evidences. Okay, so the CQC inspection team will gather the views of people who use services. Okay, so the inspection team will gather information from the people who use the services provided by the company. Yes, so from basically from that means service users, right? So the CQC team will gather views from the service users. Okay, so how do they do that? Okay, so the inspection team will speak to people individually or in groups. Okay, and sometimes the team will use comment cards placed in hospitals. Okay, so like there are some comment cards in which you can write your comments. Okay, so these comment cards are available in hospitals. So the CQC team will use these comment cards available in hospitals to gather information. Okay, and the team will also gather some information from the engagement stalls as well. Okay, and there, I mean, like engagement stalls are for the service users, right? So they will gather information from the inspection team will gather some information from the engagement stalls as well. Okay, and also the CQC team will gather information from complaints and concerns from service users as well, because there are some, I mean, there can be some complaints or concerns made by the service users, right? So this inspection team will gather information from these complaints and concerns made from the service users as well. Okay, so this is how the inspection team will gather the views of people who use the service. Okay, and then this inspection team can gather some information from the staff members in the workplace as well. Okay, so staff members means the people who are working in the workplace, right? So the inspection team can gather information from the staff as well. Okay, and in addition to that, these are some other methods through which the inspection team can gather information. Okay, so they can observe care. Observe care means they can wait for a certain period of time in the workplace and see how they provide care to their customers, how they provide services. The inspection team can wait a few hours, several hours in the workplace and see how this company is providing care or services to their customers. Okay, so observing care means observing the service. Okay, and looking at individual care pathways and reviewing records. Okay, so whatever the records available in the company can be reviewed by the inspection team, and the inspection team can also inspect the places where people are cared for, and look at documents and policies. Okay, so the inspection team can refer the documents as well. Whatever the documents available in the company, they can refer the document. The team can refer the documents as well. Okay, so these are some other additional methods through which the inspection team can gather evidence. Okay, so gathering evidence is the third stage. Okay, so once they complete this stage, once this stage is completed, the CQC inspection team proceeds to the next stage, which is feedback. Okay, so this is the last stage of the inspection process. Feedback is the last stage of the inspection process. Okay, so what happens in this stage is, so in this stage, you are basically giving feedback. Okay, so that is what, as the name itself, that is what happens in the feedback stage. Like you are giving a feedback. Okay, so yeah, so when you give your feedback at the end, these are the things that you will give as the feedback. Okay, so these are the things that you will include in your feedback. Okay, so the inspection team, the CQC inspection team will give a summary of what has been found during the visit. Okay, so the inspection team will give a summary of what they found out during the visit. Okay, and they will also highlight any issues that they have figured out. If there are any issues that they realized during the inspection process, they will highlight these issues as well. Okay, and they will also, the inspection team will also identify any action the service provider needs to take immediately. So if there are any immediate actions that the service provider should take, these immediate actions will also be communicated to the service provider, and outlines any plans for further announced visits. Okay, so if the inspection team is planning to come again for another visit, then the plans for the further announced visits can also be discussed during the feedback. Okay, so I mean, if the inspection team decided to have a visit and inspect this workplace again in the future, then these kind of further visits, these kind of future visits, the details about these future visits can also be discussed during the feedback. Okay, so the inspection team will outline any plans for further announced visits. Okay, so if they if the inspection team wants to check the place again, then they will schedule a second visit, and they will tell you the details about the second visit during the feedback stage. Okay, and explains how judgments will be made and how those will be published. Okay, so during the feedback stage, the CQC inspection team will also explain how they will make judgments based on their findings, and how their findings will be published. Okay, so are they publishing it in the inspection report, or are they publishing it in their website or whatever? How those findings will be published, this will be discussed during the feedback stage. Okay, so the inspection team will tell you how are they planning to publish their findings. Okay, so at the end of the inspection process, the inspection team will hand over a report to you. Okay, so this report is called inspection report. Okay, so this report contains all the information about the inspection process. What are the findings, and what are the immediate actions that you should take, and what are the so there can be, when it comes to actions, there can be actions that you should take immediately, and there can be actions that you can it not immediate, but you have to take in the long run. Okay, so whatever the actions that you need to take, and what are the findings that the inspection team, what are the things that the inspection team found during the visit. So all the information about the entire inspection process will be written in this inspection report. Okay, so at the end of the inspection team will hand over this inspection report to you. Okay, to the manager, or to a manager or a senior member in the workplace. The inspection team will hand over the report to a manager or a senior staff member in the workplace. Okay, so this report contains all the information about the inspection. Okay, so now let's see what are the actions taken by CQC. Okay, so CQC use their power to protect people from harm and to make sure that people receive good quality care and services. Okay, and CQC also use their power to improve the standard of health and social care services. Okay, and CQC also use their power to make the care providers and managers accountable for their own actions. Okay, so yeah, so whenever CQC takes an action against a workplace or against a professional, so this action depends on how the problems they have identified affect the people who use the service and how serious they are. Okay, so the action the action that CQC takes will depend on the severity or the seriousness of the issue. Okay, so if the issue is not that serious, the actions will be mild actions. But if the issue is a serious issue, then the actions will also be serious actions, like termination, likewise, suspension, likewise. Okay, so the action that CQC takes depend on the seriousness of the problem, of the issue. Okay, so here are some examples of actions that the CQC can take. Okay, so the CQC can issue notices like warning notices, or else CQC can make changes to a care provider's registration or to limit what they may do. Okay, so for example, by imposing conditions for a given time. Okay, so for example, suspending a professional. For example, let's say suspending a medical officer from this month to this month. Suspension for several months. Okay, so likewise, the CQC can make changes to a care providers, like CQC can limit what the professionals and companies do by taking this kind of actions, right? And sometimes the CQC can remove people from the registry as well. Okay, so making changes to a care providers registration to limit what they may do. Yes, that is another action that CQC takes. Okay, making changes to a professional's registration or like limiting what the person can do. Okay, and another action is this, like close supervisions. Okay, so sometimes CQC will decide to closely supervise CQC will decide to closely supervise the quality of care while working with other organizations to help them improve within the set time scale. So which means sometimes the CQC will decide to closely supervise the workplaces with other organizations. Okay, and other than that, here are some other actions taken by CQC: issuing simple cautions, issuing fines, prosecuting cases where people are harmed or placed in danger of harm. So prosecuting cases means legal cases, taking legal actions. Prosecuting means taking legal actions. Okay, so simple cautions, fines, legal actions. These are some other types of actions taken by CQC if they found out that you are not complying with the standards. Okay, so the details of these actions will also be mentioned in the inspection report. Okay, so if CQC is planning to take any actions against your workplace or against the professional, all the details about these actions will also be mentioned in the inspection report. Okay, so guys, that's all for today's lecture. May I know, is everything clear to you guys, or do you all have any questions? Can I get to know you? Can I get to know from you
Clear,
guys?
ma'am.
All
Clear,
right.
ma'am. Okay.
All right. Can I hear from others as well? Okay. So guys, since it seems like you all don't have any questions, we can wind up the session now. Okay, so I will end the lecture now. Yeah, so out of all the 4 learning outcomes, we have covered the first 3 learning outcomes now. So most probably you will receive the assignment next week. Probably you will, so this subject also has an assignment, which you will probably receive next week. Okay, so for now, I will end the lecture. Okay, so this note is already there in the WhatsApp, and I will, in a few minutes, I will upload to this class notebook as well. Okay, so guys, that's it for today's lecture. I will see you guys next week for the next lecture. Thanks for joining for the lecture, guys. Have a nice day.
Have a nice day, ma'am. Thank you very much.
No worries, Chanaka.